Welcome everyone. It's a pleasure to be today with you with this great session of 24 hours of lasers for the American Society of Laser in Medicine and Surgery. My talk today is about 8 minutes of laser dermatology updates 2021. And what I would like to start with is laser in pregnancy. This is something which have been of debates. There are many opinions about using lasers during pregnancy or not to use laser during pregnancy. There was a very nice article published a couple of years ago about the review of the safety of cosmetic procedures during pregnancy and lactation. And regarding the lasers, there was some mentions about laser and light therapy, where no concrete recommendations can be made for the use of lasers for cosmetic procedures. Carbon dioxide and Nd:YAG laser have been used safely to treat genital condyloma in pregnant patients in several reports. The holmium-YAG laser and pulsed dye laser have been used successfully and safely to treat erythrolysis during pregnancy, and the hair removal treatment of pyogenic granuloma with laser has been pursued safely. Permanent hair removal is not recommended during pregnancy because of the lack of safety data. Patients are advised to wax, shave, and use depilatory creams. Having said that, we know that many practitioners are using laser-assisted hair reduction during pregnancy, which I don't really encourage. I don't like to do that as much as we can due to the following factors. Number one, if there is any pre-existing congenital anomaly, then we are going to be blamed and the laser practitioner is going to be blamed. Number two, during pregnancy, there is increased production of melanocyte stimulating hormone. So the incidence of hyperpigmentation during pregnancy after any trauma is higher than other times. And that's why this is something we want to avoid to create hyperpigmentation. The other thing is that there are some acupuncture points on the surface of the skin, which we are not familiar with. We are not sure where it is, but if hit, it can lead to uterine contractions and abortions. There are few case reports of patients who had abortion during the first trimester after laser hair removal session. And the last thing is the pain. If we are treating a large surface and this is associated with pain, sometimes this can precipitate also uterine contractions, and that's why I don't really prefer to treat pregnant women. What about the operator? If the operator is pregnant, whether it's a technician, nurse, or physician, then it is completely safe. Laser is coherent, collimated, monochromatic light. It is non-ionizing radiation, so it doesn't carry any kind of risk to the fetus or to the patient herself. So those are the concerns and the things which we need to keep in mind during pregnancy. What about the lactation? It has been also mentioned that laser-assisted hair removal is not recommended during lactation, and I was surprised for that for some time. However, I realized that when there is increased prolactin level, then the response to the hair removal is really weak. And that's why it is not recommended to do laser-assisted hair removal during lactation, because the response is going to be much less than other times. And that's why it is advisable to be avoided. There is no harm, there is no risk of anything other than that. So if the patient insists, then we can do it. However, it is important to let the patient know that the response is going to be less than in other times. Large tattoos like that, this is sometimes challenging, because when we have a large tattoo like that, there are some case reports of foreign body granuloma which occurred in the regional lymph nodes. However, there's a very important report which I would like to highlight, where it was discussing the pitfall and recommendations in case of laser-assisted hair tattoo removal with pigmented lesions. And this was a review of literature published in 2013. And in this review, they realized that there were some cases associated with melanoma development after Q-switch treatment of the tattoos. And this is something I would like to highlight. Tattoo removal with the laser is something which should be done under medical supervision. It shouldn't be done by tattoo artists, because the thorough skin examination is a must before doing the laser session. This is crucial because if there is any early signs of melanoma, this has to be detected by a dermatologist. And it is not easy, even for dermatologists, not easy sometimes because of the coverage of the skin surface with the tattoo. So it needs really skilled dermatologists to be able to spot the early signs of melanoma. Otherwise, the laser treatment is going to be taking place and the melanoma is not going to be detected unless in very late stages, and it is going to be too late. So this is my message here. It is really very important to keep this procedure, the tattoo removal, under strict medical supervision in order to avoid such situations. Now, the last thing which I would like to highlight is the isotretinoin and the laser treatment during the isotretinoin. And this article was having some sort of guidelines of care during performing procedures, cosmetic procedures in patients on recently administered isotretinoin, and this was published in 2017. And the conclusion of this study was that it is safe to perform all those cosmetic procedures in patients with concurrent or recent isotretinoin administration. Among those cosmetic procedures, we have the laser hair removal, fractional laser for aging and acne scarring, and lasers for pigmented skin lesions. However, I would like to highlight that whenever we are doing those, we should not take that blindly, that it is completely safe. The fear or the concern regarding the isotretinoin is threefold. Number one, we have dry skin, and dry skin reacts very aggressively to the laser. So it's very important to hydrate the skin and moisturize the skin before we conduct the laser treatment to avoid the burning of the skin and scabbing and crust formation. Number two, and this is actually regardless if the patient is taking isotretinoin or no. If the patient is doing hair removal and the skin is dry, we have to moisturize and well hydrate the skin before we do the treatment so that we have better laser tissue interactions and less risk of superficial burns. The number two factor is the photosensitivity. During the isotretinoin treatment, there is photosensitivity, and this will lead to some sort of hyperpigmentation. So if we are using the lasers in areas which are tanned or hyperpigmented, the appropriate parameter should be used. Otherwise, we are increasing the risk of side effects. And if you are doing hair removal, it is advisable to use infrared lasers rather than the visible lasers, although the visible lasers are not of a concern. However, it is just the fact that the light exposed skin is going to be more tanned and it's going to be reacting a little bit more aggressively with the lasers. So this is to be considered. Number three is the healing. There was some concern about the healing and the slow healing of the skin during the isotretinoin treatment, which was not proven. And that's why it is better to postpone any ablative procedures till after the isotretinoin treatment. However, as we can see here in the conclusion of this study, is that the fractional laser is okay, but this might be the non-ablative fractional. For the ablative, I would prefer to wait till we finish the course of the isotretinoin. So this is my presentation. I hope you enjoyed it, and I'll be very happy to answer any questions at the end of the session. Bye.